We are online for you 24/7. The People's Radio Station, Kabayan Radio 94.3. You're listening to Kabayan Radio 94.3, the first and only Filipino radio station in Qatar.
Keep listening. Keep listening. Stay where you are. Live. Online. On air. And on ground. Kabayan Radio 94.3.
With more than 257,000 unique audience and more than 60,000 followers, Kabayan Radio 94.3 FM is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@kabayanfm.com. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3. Kabayan Radio 94.3, the first and the only Filipino radio station in Doha, Qatar. My name is Ate Girl, RJ Andy, and welcome to the Doctor is In special Wednesday edition. And in this 1-hour program, mga kabayan, we are going to discuss about abnormal menstruation, pregnancy, causes of cervical cancer, and of course, what women can do to avoid it. And we are now live at our Kabayan Facebook page, so you can also join us here. And for those who have not yet followed us, mga kabayan, please do sa ating Facebook page and Instagram, and that's at Kabayan943. And tonight, we are very fortunate, mga kabayan, to have with us an associate in obstetrics and gynecology of Shefa Polyclinic. And she graduated from University of Santo Tomas, Manila, Philippines, with a Bachelor of Science in Pharmacy in 2000. She got her degree as a Doctor of Medicine in 2004 and later finished her residency training in obstetrics and gynecology in 2009. And she has been a consultant in obstetrics and gynecology in the Philippines since 2010. And later, mga kabayan, started practicing obstetrics and gynecology in Qatar since 2017. So mga kabayan, please help me welcome the beautiful Dr. Princess Lizardo. A round of applause, please. Hi, Doc.
Hello.
Good evening po. Kumusta?
Okay naman.
Welcome to Kabayan Radio and the Doctor is In special Wednesday edition. We're so glad that you are here finally with us tonight.
Thank you for having me.
Kumusta naman yung naging bakasyon mo? Nakapag-bakasyon ka ba sa Pinas?
Hindi ako
For this year?
nakapag-bakasyon. So,
Here, local leave.
Dito, hindi naman din. So, I just transferred to Shefa Polyclinic. So,
Shefa Polyclinic. Can we say hi sa lahat ng mga colleagues mo dyan?
Yes, I'd like to say hi to all the staff and employees of Shefa Polyclinic, especially the Deering branch.
Yes, hello guys.
Hello, guys.
Thank you so much. And eto Doc, since we had, we have come across with a lot of patients from your trainings, from your experience. Unang-una, let's talk about abnormal menstruation kasi ito talaga yung parang napaka-related these days. Kasi last week, I had to have the talk with my inaanak approaching puberty. Ito yung napag-usapan natin, and I knew it was time to include and face some serious questions coming from her. Unang-una kasi very close kami. Parang I treated her as my own already and super close kami ng mom. So, parang as it turned out, I was explaining what a period is, how it works, and why exactly women have to have them. So, unang-una, can we define why do we call it menstruation?
Well, technically, menstruation came from the Latin word menses, which means month, and then the Greek word mene, which means moon. So before, in the ancient history, they relate the menstrual cycle to the moon cycle because technically they lasted for around 29 days. So maybe that's the reason why the menstruation, that's where the menstruation word came
comes from the Latin word menses,
Yes.
which translate to month. Well, it makes sense, no? Kasi every month din naman. And so eto napapansin ko, why are some periods so different? Kasi I know some women who have heavy, frustrating periods, like would last a week. And meron ding ibang mga babae that they can get away with 2 to 3 days. What gives and why is it so different from any other women?
Well, in general, the menstruation should occur within 21 to 35
21 to
days.
35
And it
days.
should last for 7 days. So technically, that's the normal menstruation. Although some patients would have bleeding after 2 weeks, or they would have bleeding more than a month, or they will have menstruation after 2 months, or they would have bleeding for 10 days, for 14 days. Of course, this is considered abnormal. Aside from the medical problems, aside from the pathological factors, sometimes stress, sometimes weight gain, sometimes depression can affect our menstruation, because during the stress, our body is also producing hormones, which can interfere with the female hormones, thereby affecting our menstruation.
I totally agree with you. Kasi nga, especially when you mention about depression, sometimes it manifests in our body, di ba? Yung health natin. And some of which talagang nangyayari siya, especially kapag stress na stress ka. It could be from work or whatever, you are struggling for the past few weeks or for the past few months. Now, since you mentioned a while ago na may mga women na nakaka-experience ng heavy bleeding. So, I think it's the time for them to also consult with doctors, right? Kasi, of course, it's not normal.
Well, the normal menstruation is just 7 days. So if they're experiencing menstruation for lasting for 10 days, or if they're using diapers, or if they're using 10 pads per day, that's not normal. So of course, they have to see a
It could
gynecologist.
be a sign of problem na.
There
So they
could be a
really have
problem. Yes.
to consult the doctor. Now, since you've also mentioned a full menstrual cycle lasts from
The full cycle should only last for 7 days. So if the menstruation is lasting for 10 days, for 2 weeks, for 1 month, this is abnormal. So they have to see a gynecologist.
So I've done a little bit of research pala mga kabayan. Meron pala tayong mga tinatawag na stages of menstrual cycle. Can you please elaborate it for our viewers?
Well, for the endometrial cycles, of course, we have this proliferative phases, the secretory phases, and for the ovarian cycle, we have this proliferative, the luteal phases. So technically, it's where we produce the hormones, and that's the reason for the menstruation. So technically,
Dito ba din kumikikan minsan yung mga cravings natin na parang hindi natin alam na parang gusto kong kumain for the past few days.
the hormones, the
Right.
fluctuation in the hormones that's causing the cravings, our bloatedness. So lahat yun, it's because of the hormones.
It's also possible to some women experiencing din na parang wala silang gana kumain.
Meron din minsan, but usually you really have cravings.
Like what kind of cravings? Sweet. Ito, napapansin ko. Kung talagang
Usually sweets,
papunta na
but
ako doon,
technically
sweets.
nothing in particular. But we really love to eat. We really love to eat during this
Women
time.
love to eat. In general, okay. Actually, parang naging given na eh. Pag sa babae talaga, di ba? Sabi nga nila, huwag mong gagalitan yung babaeng gutom. Kasi talagang matagal kayo magiging okay. Anyway, since you also have the mention about the stages, Doc, many women will experience yung mga tinatawag nating irregularities, like mga irregular periods at some point in their lives, no? And it's particularly common, especially for young women. Ito yung napapansin ko. I have siguro mga 5 in the circle of friends that I had na nakaka-experience ng highly irregular periods talaga. So, how to tell if your period is regular at meron ba tayong pwedeng gawin dito para at least maging regular siya?
Well, technically, for teenagers, we don't expect them to have normal menstruation until they reach their 18 years old. Because normally, the hypothalamic pituitary ovarian axis, basically, it's not normal during that time. So technically, until 18 years of age, it's okay for them not to have normal menstruation. Unless they're bleeding profusely or they're bleeding for more than 7 days, of course, they have to see a doctor. But in general, for the reproductive age women, so technically, the usual menstruation, again, is between 21 to 35 days and lasting for 7 days only. So if the patient would, a lot of patients would complain to me, Doc, nagka-mens ako twice this month. I normally hear this.
Na-experience ko din
Tapos
yan.
so when we ask for the history, for the exact date of the menstruation, so they will tell it's the first week of the month and then last week of the month. So when you count that, that's more than 21 days already. So it's normal.
So it's normal. Minsan lang talaga parang siguro hindi natin naisip, ba't pangalawang beses ako ngayon? But it was really not the case. So you just have to count the days.
There are also some patients who would get their period more than 35 days. So example, you get your period first week of the month,
Okay.
and then you'll get another period last week, next month. So technically, that's more than 35 days. It's not normal anymore. So again, you have to see a doctor.
Sa mga kaso mo na naging patients, yung parang anong yung masasabi natin na super taas, mahaba yung irregularities? Yung parang how many months was it? Na talagang super mahaba para sa
Normally, even
Yes.
1 year, they don't get the
1 year.
period for a year. So that's really abnormal.
And they took some vitamins or mga supplements din about
We give medicines in order
Medicines.
to regulate the menstruation.
and then nakakatulong din naman or may mga cases talaga na parang extreme.
It helps, and of course, if the patient is overweight, we advise them to exercise because it also helps regulate the menstruation.
And how about dysmenorrhea?
Dysmenorrhea is also part of menstruation because during menstruation we are releasing prostaglandin, which can cause pain or cramps. But there are also some certain diseases which can cause dysmenorrhea. So we can have ovarian cyst
Yes,
or
yes,
adenomyosis. So for all patients who are coming to me, to my clinic, complaining of dysmenorrhea, I always advise for ultrasound in order to make sure that it's just a typical dysmenorrhea and that she doesn't have ovarian cyst or that she doesn't have any other
Like a
problem.
typical dysmenorrhea, like cramps
Yes.
lang yun na experience.
So if the ultrasound will reveal it's normal, she doesn't have cyst, she doesn't have any problem. So I would just tell them it's the typical dysmenorrhea. Just take
So nothing to take
just
ba
pain reliever.
or
She can take pain reliever.
pain reliever? Okay.
And SEDS.
So there are a number of different factors no, na nakaka-affect ng women's cycle as you've mentioned a while ago. And I've also read an article na as we get older daw, Doc, for example, our period will get lighter and become, parang more regular na. So what causes abnormalities ba in menstruation and what are the other factors that can make you irregular then?
Well, in general, if the patient is bleeding profusely or is bleeding heavily, normally the patient could have some polyps or could have adenomyosis, the fibroids, maybe there is some malignancies, or maybe they're just taking medicines that would cause the bleeding,
So pwede din yun?
like pills.
oh yes.
The most common is pills. If the patient would come to me saying she's bleeding, of course I would ask for medications, the medications that she's taking. And the most common reason for the irregular menstruation, like if the patient will not get her period for 2 months, for 6 months, the most common is polycystic ovaries. So I'm sure a lot of people have heard about PCOS. So when you say
Yes, of
PCOS, it's a syndrome. It's characterized by irregular menstruation. Of course, you will see in the ultrasound that there are multiple or more than 10 cysts in the ovaries. And of course, there is hyperandrogenism, meaning there's a rising level of testosterone in the female body. So patients have pimples.
Ayan,
Patients
lumalabas.
have facial
Weight
hair.
gain.
Yes, weight gain is common.
It's common. And may tanong din ako, Doc. Meron bang mga cases na naging regular siya for how many years? And then biglang naging irregular?
It happens, yes. So maybe she gained weight.
Ayun yun.
Maybe,
Okay.
yes. So that's one of the factors. Or maybe it's only that time na nag-manifest si polycystic ovaries niya. Or maybe there is some development of other problems like mass, fibroids, polyps,
So we really can tell, no, na ngayon,
Yes.
regular ka nung teenagers mo. It could happen later, mga 30s or something like that. And the only thing that they need to do is to consult doctor
See a
right away.
gynecologist.
Yes, that's correct. All right, thank you so much for that, Doc. And that was very helpful, no, especially to all women out there na talagang andito sa sitwasyon na ganito and very frustrated sila. Situations related to abnormal menstruation. And it is indeed an added knowledge for us to be more aware of what's happening in our body during those times. So anyway, mga kabayan, we've just discussed about abnormal menstruation with Dr. Princess of Shefa Polyclinic, but we are not yet finished. We're still on the first part, mga kabayan. So up next, for the second part of The Doctor Is In special Wednesday edition, we will talk about pregnancy, Doc, and the causes of cervical cancer and what women can do to avoid it. So we'll just have a short break, mga kabayan, and we'll be right back.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Combine Radio 94.3. We are online for you 24/7. The People's Radio Station, Kabayan Radio 94.3. You are listening to Kabayan Radio 94.3, the first and only Filipino radio station in Qatar.
Keep listening. Keep listening. Stay where you are. Live. Online. On air. And on ground. Kabayan Radio 94.3.
With more than 257,000 unique audience and more than 60,000 followers, Kabayan Radio, Kabayan Radio 94.3 FM is the best. Is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@kabayanfm.com. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Once again, mga kabayan, good evening sa ating lahat and welcome to Kabayan Radio 94.3, the first and only Filipino radio station in Doha, Qatar. Once again, my name is Andy and welcome to tonight's episode of The Doctor Is In special Wednesday edition. And we are now live here at our Facebook page, so you can also join us right there, mga kabayan. And for those who have not yet followed our official social media accounts, please do click like and follow. And for you to be more updated with our current happenings here in Doha, Qatar. And again, we have here Dr. Princess of Shefa Polyclinic. And on the first part of this edition, we've discussed about menstruation, yung mga causes and the things that we can do about it. Now, before we go ahead and move to our next topic, we're gonna be reading comments or questions coming from our Facebook viewers. Can you please say hi to them? Kasi nakikinig sila sa'yo. Nakikiview sila sa'yo, Do.
Hello to...
You're pretty, Do. Sana all. Siyempre, wala kami mga guests na hindi pretty dito. Anyway, so we've got one question coming from John Villa. Sabi niya, what's the cause daw of myoma? And why some women having it? They said it's all about irregular menstruation. Could it be daw ba?
Well, technically, myoma. So any women can have this. Any
Even if
women,
healthy,
as long
kinakain
as
namin?
we are menstruating, as long as we have hormones, we can have this. So all
So
you
hard to
have
be
to
a
do
woman.
is have yourself checked, do an ultrasound from every year or from time to time, just to make sure if you have it or not. So usually the symptoms would be you'll have abdominal pain or you have pain here in the lower abdomen. Sometimes you'll have abnormal bleeding or sometimes you will notice abdominal enlargement. So these are the signs that you might be having myoma. But myoma is not cancerous, it's not malignant.
And it could be taken out, right?
It should be removed by surgery if it's large, if it's big. But usually if it's a small, like 2 centimeters, so technically we can observe and monitor.
I see. Hindi dapat diretso-diretso ka agad.
Not
So,
necessary.
dapat tinitignan muna kung if it's okay na tanggalin o hindi, right? Alright, so we have another question dito sa ating Facebook page coming from May Benny. What to do to prevent pain during menstrual period? My daughter had her menstruation at early age of 9. And she's having dysmenorrhea. How to help them minimize the pain, Doc?
Well, technically, as I have said, our menstruation contains prostaglandin, which can really cause pain. So we can't prevent that.
Oh, yeah.
You can only relieve by unfortunately. So maybe they can do warm compress, and of
Yan
course,
yung
if
ginagawa
it's really painful, they can take NSAIDs, ibuprofen, mefenamic acids.
Can we take leave from work?
Yes.
I usually do that kapag hindi ko na kaya kasi I am a dysmenorrhea warrior, mga kabayan. So, shout out sa lahat ng mga dysmenorrhea girls dyan. Like, I really take...
For this particular patient, since she is only 9 years old, so technically it's just
Papabago pa ba yan?
maybe it's just typical. Hopefully, it's just typical dysmenorrhea. But of course, if the pain will really persist, of course, we have to do ultrasound just to make sure that this teenager doesn't have ovarian cyst.
All right. Thank you so much, Doc, for answering the questions coming from our Facebook viewers. And now let's move forward to the most exciting part of every woman's life, the pregnancy. Di ba? Alam naman natin na being pregnant raises lots of questions, okay? Especially for the first-time moms. And we may be wondering what the early signs of, pregnancy, like yung mga cravings natin, ano yung mga dapat na mga vitamins na dapat natin tinitake, or ano nga ba yung mga any time of the day na mga cravings na dapat nating sundin or hindi. So, eto lang, Doc, pinakauna kong tanong, without using a pregnancy testing kit ba, how will a woman identify that she's pregnant or just menstrual irregularities?
Well, for a patient who has regular menstruation, and if she missed her period for a month or more, then technically
Like 1 month is enough.
yes, she could suspect that
Not
maybe
2 weeks, ha?
not 2 weeks.
Baka maging asumera tayo dyan apart.
Well, technically 1 month or at least 35 days because the normal menstruation is 35 days. So if you miss your period for at least 35 days, then maybe you're pregnant, especially if it's associated with nausea or you feel you have breast tenderness, if you're vomiting, if you feel weak, then maybe you will really assume.
morning sickness.
Yes, you will really assume that you're pregnant. But of course, we don't rely on these symptoms because these are just presumptive diagnosis for pregnancy. We have to confirm it by doing
Yes,
blood tests and
Of
ultrasound.
course. May napapansin din ako, may mga ibang buntis na hindi nagkakaroon ng morning sickness. Bakit yun, Doc? Ba't ang swerte nila?
May masuswerte. Well, not everyone would have cravings, not everyone would have vomiting.
wala lang,
Parang
no?
wala lang. May masuswerte. Maybe it's because of their body's reaction to the fluctuating hormones. So that's why not everyone has the same symptoms.
And since we've already asked about cravings, ano nga ba yung month na typically nagsistart yung pregnancy cravings natin?
Again, not everyone has cravings, but in general, during the first trimester, during the first 3 months, they would have these cravings because of these hormones, the pregnancy hormones. So, but normally, sometimes it could persist up to the second trimester, sometimes up to the third trimester or ninth
Talagang
month.
umaabot doon.
But normally, it's just on the first trimester.
Okay. Alright. And ito din, ang dami kasi nagtatanong sa atin dito kasi of course, kapag ka-pregnant ka, talagang nag-weight, nag-gain ka ng weight. So, how much weight should a pregnant woman is allowed? Or mga ano ba yung standard doon? O kung hindi man standard, pero hanggang doon lang.
Well, we are expecting pregnant patients to gain weight as much as 24 pounds. So during the first trimester, we don't expect them to gain weight because this is the time wherein they're not eating, they're vomiting. So normally, we just expect them to gain at least 2 pounds. During the second trimester, on the 4th to the 6th month, where we are expecting them to gain 11 pounds. And on the 7th to the 9th month, the third trimester, another 11 pounds. So total of 24 pounds, the whole 9 months.
Oh, okay. If it's gonna be more than that.
It's okay, but of course, there's a risk of bigger baby macrosomia and a risk for cesarean section eventually.
Especially kung maliit kang babae, no? So, talagang ina-avoid yan na masyadong malaki yung bata. Kaya nga sinasabi nila dun sa Philippines, sa labas mo na lang palakayin yung bata, wag ka masyadong kumakain. Di ba? May mga
Yes.
ganon. Talagang pinaprangka ng mga doctors. Kasi nga, syempre, mahirap manganak, right?
Yes.
So eto, so you're gonna get most of the vitamins and minerals you need by eating healthy when you are pregnant. But are we gonna be recommending supplements or ano nga ba yung mga vitamins na dapat tinitake ng isang buntis?
Well, the most important, especially during the first trimester, is the folic acid, of course, to avoid abnormalities to the baby, the neural tube defects. And then afterwards, of course, we recommend multivitamins, iron supplement, and calcium, and of course, vitamin D to prevent bone fractures, skeletal deformities, etc. Basically, these are the important vitamins.
Di ba, nung siguro mga unang panahon, walang mga
Vitamins.
ganito. Sabihin mo, saan nila nakuha? Like,
From food.
Food. Like,
From food.
yung mga vegetables. Kasi,
Yes.
tas sariwa ang hangin.
Yes.
Ganyan, no? So, I think talagang swerteng-swerte yung mga magulang natin noon, yung mga lola at saka lola natin. Kasi nga talagang super fresh yung hangin, especially kapag tumitira ka sa probinsya.
Healthy pa yung mga food intake
Yes,
before.
totoo. Yung organic lahat. Anyway, ito nga. Ito na, since napag-usapan natin yung weight gain, pwede po bang mag-exercise yung buntis?
Well, yes. We do not advise the patient to limit their physical activities or exercise as long as it would not cause injury, as long as they
okay.
would not develop extreme fatigue. So they can do any exercise. But of course, if the patient has signs of miscarriage or has bleeding, has cramps or contractions, of course, we don't advise them to exercise during that time.
But they should not
Otherwise,
lift
they
weights. Yung super talagang...
Super bigat, wag naman.
Nakikita ako ng mga video,
I
no?
know.
Yeah. Sabi ko, kumusta naman yung mga OB-GYN nito?
As long as these weights would not cause trauma to their
Yes,
abdomen,
true.
of course, maybe it's fine.
It's fine. Depende din talaga sa...
Depende sa
kaya
patient.
nila, no? Sa force din nila. And since pregnancy naturally weakens the immune system, which means it's harder to fight off infections, nagre-recommend ba tayong kumuha ng flu vaccine for pregnant women?
Well, yes, flu vaccine is very much safe for pregnant patients. So they can take it regardless of their age of gestation, regardless whether it's on the first trimester or on the second trimester. So they can have the flu vaccine anytime.
All right. So, okay, sa ating mga kababayan dyan na nasa ating Facebook page, if you do have questions, mga kabayan, regarding sa pregnancy, pwede pong i-post nyo dyan sa ating comment box. And do not forget to always share our Facebook Live video. We are here live with Dr. Princess of Shefa Polyclinic. And thank you so much, Doc. I'm pretty sure a lot of our soon-to-be mom are actually quite fascinated, no? Kung ano nga ba yung journey ng pagbubuntis and what's the most important things na dapat nila i-take note to ensure a safe delivery and, you know, a healthy baby. Now, tignan natin kasi parang may mga question nata dito. Ay, pa-shoutout daw, Doc, oh. Sabi dito, pa-shoutout naman si Gio Angelo Pengson. Do you know him? Ay, ang dami mong... Ay, ang daming fans, hindi niya nakilala. May Bennett's in Deering Road opposite of Lulu Hypermarket. Okay, dalawang branch tayo, no, sa Shefa Polyclinic. Can you please invite them?
Yes, our clinic is located in Deering Road opposite Lulu, so it's called Shefa Polyclinic.
Alright. Now, since hinihintay natin kung may mga questions ba regarding pregnancy, mga kabayan, moving on to the last topic, which is about cervical cancer, mga causes nito and things that we could do, mga kabayan. And meron akong nakita dito, according to World Health Organization, worldwide, yung cervical cancer daw, Doc, is the fourth most frequent cancer in women with an estimated 604,000 new cases in 2020. Now, gusto ko po sanang tanungin kung ano nga ba yung cervical cancer, especially sa mga taong medyo hindi pa sila fully aware of what is it.
When you say cervical cancer, it's the presence of abnormal cells or cancer cells in the cervix. And the cervix is the lower portion of the uterus, the one connecting to the intimate part of the female. So yes, it's the fourth most common cancer worldwide, and it's the third most common cancer in the female reproductive tract.
Ito yung mga nababasa kong misconception. Sabi nila pag lumalaki daw yung edad, mas risk daw sa cervical cancer. Totoo nga ba ito?
Well, because during the early stage, you don't notice or you don't have symptoms for cervical cancer. That's why they notice it at the later age. But nowadays, even 20s, early 30s are being diagnosed with cervical cancer.
Really?
Yes.
Like 20s?
Yes. Late 20s.
Genetics po ba ito? O...
Well, the most common cause of cervical cancer is the HPV virus or the human papilloma virus. So the HPV virus is a sexually transmitted virus. So technically, we get it from intercourse.
Yes, okay. Contact, no?
Contact.
All right, so we have a question coming from John. Sabi niya, Doc, question, the right age to have menopause age is 50 or 55. But now, if the woman is still having mens until 58, can she possibly be pregnant? Or up until what age ba nabubuntis yung babae?
As long as the patient is menstruating, there is a risk for pregnancy, even if she's already 58 years old. So yes, so if they don't want to get pregnant, they have to be cautious.
Ah, okay. Especially in a very dangerous na yung mga
But
ganun.
average age for women is 50 years old. So we rarely hear 55 to 58.
Pero may mga cases na
Yes,
gano'n, no?
yes.
At the age of 60 years old. I think I had read an article na at 60 years old, talagang nanganak pa siya. And very risky yung pregnancy kapag ka gano'n. Kasi nga, bakit nga ba risk yung gano'n?
A lot of complications because most likely that patient is not necessarily old, but technically maybe she is having hypertension already, maybe she has diabetes already. So technically, those are the possible complications for the pregnancy.
Alright. So, balik naman tayo sa cervical cancer. Ano ba yung mga symptoms mga early symptoms of cervical cancer?
So number one is vaginal bleeding. So if the patient would notice abnormal bleeding, example, she will have bleeding in between her menses, so that's not normal. Or if the patient will have bleeding after the contact, so that's also normal. Or if a patient is menopause, when you say menopause, the patient did not get her period for 1 year already. So if the patient is menopause, so she is not supposed to have bleeding afterwards. So if the patient will have bleeding, maybe there is a problem, maybe there is cervical cancer or other problems.
Alright, since napag-usapan na natin yung mga risk, kung ano nga ba yung cervical cancer, meron po ba tayong dapat gawin para at least ma-avoid ito? Ano nga ba yung mga tests na pwede natin gawin?
Well, the most important is pap smear. Pap smear is the screening test for cervical cancer. So it's a simple test. So we only get sample from the cervix, we send it to the laboratory, and the results will come back, and it will reveal whether the patient has abnormal cells or has normal cells, etc.
Ano ba yung mga nakikita sa pap smear, Doc? Ano yung mga parang hindi ko alam kung status ba tawag
Normally,
doon.
the result would be negative for intraepithelial lesions, meaning negative for precancerous lesions, and negative for malignancy or negative for cervical cancer. But in some cases, there are some precancerous lesions that would be seen. So technically, we have to do other tests in order to check and in order to document and in order to confirm that hopefully it will not lead to cervical cancer.
Like ano yung other tests aside from pap smear, Doc?
The HPV DNA test,
Test, okay.
and other than that, of course, we proceed with colposcopy. And the last stage is, of course, surgery. Hoping that the patient will not develop cervical cancer.
Ayan, so we have a question coming from Nice Morales. Sabi niya, good evening RJ, Andy, and Doc Princess. Ask ko lang po if you're a cancer survivor for the cervical cancer, is it possible that someday babalik pa din ba, or how long dapat magpa-check up?
Well, technically, for all cancer patients, there will always be a risk of recurrence. So no matter what age or no matter how many years they survive. So technically, continuous monitoring, continuous check-up.
Very healthy yung mga kinakain mo, Doc.
Yes, yes.
Exercise, talagang may chance talaga na babalik siya.
Kasi even after 10 years, minsan magkakaroon pa rin ng malignant cells. So technically, you have to see your doctor from time to time.
Since napag-usapan natin yung pap smear, how often should a pap smear be repeated? Like in a year or mga
Well,
times?
nowadays, they are recommending it to be done every 3 years. But of course, if there's a problem, if there is an abnormality or precancerous lesion, we can do it maybe every 6 to 12 months.
6 months kapag ka may nakakitang may mga abnormalities. Alright, mga kabayan, kung meron pa po kayong mga questions dyan, let us know. Magbabalik kami. We're just going to accommodate mga questions sa pagbabalik natin. We'll be back.
Is well. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Get supreme and quality healthcare in Qatar. Al Shefa Polyclinic offers the most affordable medical services for X-ray, ultrasound, laboratory, and physiotherapy. They also have specialist doctors in orthopedic, OB-GYN, ENT, internal medicine, and pediatrics at unbeatable consultation rates. Also available are COVID-19 PCR and rapid antigen tests at amazing prices. Visit Al Shefa Polyclinic now at Deering Road or Karatiat branches. For appointment, call 4408-9888 or 4466-0330. Al Shefa Polyclinic, your supreme polyclinic in Qatar.
We are online for you 24/7. The People's Radio Station, Kabayan Radio 94.3.
The best music that you want to hear. Morning, noon, and night.
You're listening to Kabayan Radio 94.3, the first and only Filipino radio station in Qatar.
Keep listening. Keep listening. Stay where you are. Live, online, on air, and on ground. Kabayan Radio 94.3.
With more than 257,000 unique audience and more than 60,000 followers, Kabayan Radio 94.3 FM is the best. It is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@kabayanfm.com. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Once again, mga kabayan, good evening and welcome to our The Doctor is In special Wednesday edition with Dr. Princess here of Al Shefa Polyclinic. Thank you so much, Doc. And ngayon, ang dami pong mga nagka-question. Ready ka na ba? Baka ayaw mo na sa susunod, Eto na. Actually, may nagtanong coming from our Kabayan Radio staff. Can you elaborate it para malaman din ng ating mga kabayan? It was about hysterectomy.
Hysterectomy. Well, for some patients who underwent hysterectomy, meaning they the uterus and ideally the cervix was removed, so they both are removed during the hysterectomy procedure. So during that time, the only thing that they will not experience is menstruation and pregnancy. So other than that, there will be no other symptoms or there will be no other complications. So, but in hysterectomy, both ovaries and the tubes are left. So technically, you still have to see your doctor, you still have to do ultrasound because to monitor the possibility of development of cyst in the ovaries.
So mga ilang percentage yung risk factor nito?
Ng cyst? Well, around 25 to 30%.
Alright. And meron din tayong question coming from Maria Rovel. Sabi niya, good evening po, ano po ang mga signs and symptoms ng menopausal?
Well, technically, if the patient is around 50 years of age and they're not getting their period every month, and sometimes they have hot flashes, yung parang kahit naka-AC, init na init sila, that's hot flashes. Or they would wake up in the middle of the night, they feel so hot, they're perspiring. So technically, that's hot flashes.
Kahit na super malamig naman.
Kahit super malamig. So
it comes from within,
yes.
right?
So these are the usual complaints of the patients who are entering menopause.
All right. So eto, may nagtatanong, is there a chance our endocrine affects our hormones, especially if we have a goiter or endocrine issues?
Yes. Every time a patient would come to us complaining of abnormal menstruation, we always check for the thyroid. We also check for the prolactin. Prolactin is a hormone of the breast. So because both can also affect menstruation and eventually fertility, the chance for pregnancy. So yes.
All right. And one question andito din, coming from Danjing Santos. Doc, ano po ba ang mga causes ng cyst sa ovary?
Well, hormones pa din. So technically, again, as long as we are menstruating, we have menstruation, we are in the reproductive age, we can develop cysts in the ovaries, we can develop myoma in the uterus. Yes. Wala excuse, even doctors, even nurses, even celebrities.
Even celebrities,
Yes, we
no?
can all have this. So we just have to check, we just have to do ultrasound.
Okay. Eto may tanong. Ang daming tanong, Doc. Are you okay? Do you feel any pressure right now? Anyway, eto na nga yung tanong, Doc. Coming from Leo Girl, pag sa pregnancy, tas nagbigay ang OB ng vitamins, everyday take, so 30 tabs. Bale, 15 tab lang iniinom ko. Okay lang ba? Dahil pakiramdam ko, lumalaki tiyan. Baka mahirap pag manganak na.
That's the usual misconception. They feel that the vitamins would cause the baby to become super big. So technically, hindi naman. It's still the food intake that would cause the macrosomia or the big
Nagawa
baby.
yung excuse yung vitamins sa pagkain po yan. Alright, so far wala naman na tayong mga questions dito, no? And salamat, Doc. Unfortunately, our 1-hour program of The Doctor Is In, mga kabayan, is coming to an end. And paki-invite naman sa ating mga listeners to follow you or Shefa Polyclinic kung gusto nilang magpakonsulta or kung gusto nila ng any private talk with, of course, the experts, mga kabayan.
Yes, my schedule in Shefa Polyclinic is 9 to 12 in the morning and 4 to 9 in the evening, every day except Friday. So Shefa Polyclinic is located in Deering Road, opposite Lulu Hypermart.
And you also have one in Karatiat, right?
Yes, we have one in Karatiat.
All right, there you have it, mga kabayan. We just heard Dr. Princess Lizardo of Shefa Polyclinic, and it was an incredible pleasure
Thank you.
To sit down and discuss important things about sa mga gantong bagay. Kasi importante talaga sa aming mga babae na at least maliwanagan kami. We are aware kung ano man yung nangyayari sa mga katawan namin. So, thank you for taking the time, Doc.
Thank
Really
you.
appreciate for
Thank
sharing
you.
ideas and expertise with viewers. It has truly been a privilege. Mga kabayan, that's it for tonight po. Salamat sa ating mga Facebook viewers. Hoping that we have a lot of important thoughts na natutunan. And please continue lang to watch more of our The Doctor Is In. And syempre sa ating mga kabayan radio shows. And of course, sa Usapang Kabayan din natin ng mga special edition. I'm hoping ma-invite ka din namin for the Usapang Kabayan soon, okay? Let's talk about your love life this time. Enough with those medical terms, Doc. Enough with those. Anyway, sa ngalan po ng pamunuan ng Kabayan Radio 94.3, this has been your Ate Girl, RG Andy, for The Doctor Is In special Wednesday edition tonight. Signing off, Keep safe, everyone. Thank you so much, Doc.
Thank you. Thank you so much.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.